Whooping cough, medically known as pertussis, is a highly contagious bacterial infection that primarily affects the respiratory tract. Despite the availability of vaccines, whooping cough remains a significant public health concern, particularly for infants and young children. This video aims to provide a comprehensive overview of whooping cough, including its causes, symptoms, treatment, and prevention strategies. Causes: whooping cough is caused by the bacterium Bordetella pertussis. It is spread through respiratory droplets when an infected person coughs or sneezes. The bacteria attach to the cilia, tiny hair-like structures lining the respiratory tract, releasing toxins that damage the airways and lead to inflammation. This inflammation causes the characteristic symptoms of whooping cough. Symptoms: the symptoms of whooping cough typically progress through several stages. Catarrhal stage. This initial stage resembles a common cold, with symptoms such as a runny nose, sneezing, low-grade fever, and a mild cough. This stage lasts for 1 to 2 weeks and is when the infection is most contagious. Paroxysmal stage. During this stage, which can last for several weeks, the cough becomes more severe and frequent. Coughing fits are often accompanied by a distinctive whooping sound as the person gasps for air after coughing. These fits can be so intense that they cause vomiting or exhaustion. Convalescent stage. In the final stage, the cough gradually lessens in severity and frequency, but it may persist for several more weeks. Fatigue and other symptoms may also linger during this stage. Complications. While whooping cough is usually not life-threatening in healthy adults and older children, it can be serious and even fatal, especially in infants and young children. Complications may include pneumonia, seizures, apnea, temporary cessation of breathing, dehydration, brain damage from lack of oxygen during severe coughing fits, death, particularly in infants under 6 months of age. Treatment. Early diagnosis and treatment are crucial for managing whooping cough and reducing its spread to others. Treatment typically involves antibiotics, such as azithromycin, clarithromycin, or erythromycin can help reduce the severity and duration of symptoms and prevent the spread of the infection to others. They are most effective when given early in the course of the illness. Supportive care. In addition to antibiotics, supportive care, such as rest, fluids, and humidified air, can help alleviate symptoms and promote recovery. Over-the-counter cough suppressants are generally not recommended as they may interfere with clearing the bacteria from the lungs. Prevention. Vaccination is the most effective way to prevent whooping cough. The DTaP vaccine, which protects against diphtheria, tetanus, and pertussis, is routinely given to infants and young children in a series of doses starting at 2 months of age. Booster doses are recommended during adolescence and adulthood, as immunity from childhood vaccination wanes over time. In addition to vaccination, other preventive measures include avoiding close contact with anyone who has whooping cough, practicing good hand hygiene by washing hands frequently with soap and water or using alcohol-based hand sanitizers, covering coughs and sneezes with a tissue or the elbow to prevent the spread of respiratory droplets. If you like my video, then subscribe to my channel for more updates. Thanks for watching.